Rina Rossi. I am going to be your nurse today. What's going on with you today? Oh, I see that you're having a hard time breathing. Let me get the oxygen for you. And let me raise the bed for you so you can have a better time breathing. Okay. What is your name? Bob. And how old are you, Bob? Have you had these symptoms before? Do you have any pain? Where is the pain? On the right side. And how would you describe that pain? Oh, it's sharp. Let me take your vital signs. Let me check your oxygen. Let me listen to your lungs. Could you get up a little bit? I want to listen to the back. Okay. Thank you. Let me call the doctor. Hi, Dr. Tenson. This is Nurse Rina. I have Mr. Bob, a 25-year-old male, who presented with shortness of breath and acute sharp pain. When he breathes in, he feels the pain. He's alert and oriented time 3. His vital signs are respiration is 32, oxygen is 86, blood pressure is 86/54, heart rate is 130, and his pain is 10 out of 10. There are absent some breathing sounds on the right lung. Can you please come stat? Thank you very much.
Hi, my name is Dr. Tanzania. So what's going on? Just looking at the sideline. Oh, yeah. You're having pain? Okay. Where is your pain? No. Point where you're having pain on your left chest or right chest? Okay. So I'm looking at your chart here, and it shows that you don't have any history of respiratory disorder or any history of smoking. Is that true? Okay. So I want to listen to your lungs one more time. So.
What?
And one time on the back. Thank you. So, one side of your lung, the right side, it looks like there's no air moving through. Do you feel any pain here, you said? No, sharp pain? Okay, so, I will order a chest x-ray to see what's going on with your lungs and also some blood tests, to run ABGs to check your oxygen level, okay? And then I will come back with the results. Okay. Hi, So I'm back with the results. This is your chest x-ray. So one side of your lung, which is your right side, where you're having pain right now, it's not full of air and it's round, meaning that the right side, your right lung is collapsed right now.
How can I fix it, doctor?
So to fix the problem, number one, we require an evacuation of the air to restore the negative pressure, and a chest tube will be inserted in the affected area, which is your right lung. But I'll use local anesthesia to avoid any pain. So after the insertion of the tube, another chest x-ray will be needed to confirm the placement. And after confirmation of the tube, an underwater seal drainage system will be attached to the tube until the air or fluid is completely removed. Okay? Does that sound good? So your nurse is coming. Do you have any questions for me? Okay. All right.
So now I'm gonna show the underwater drainage system, how it works, how to take care of it, how to assess the patient, and this device. This is the underwater drainage system, and the patient is connected to this system, and is going to drain the fluid and air out of the pleural space. This system consists of 3 chambers. They are like 3 different bottles. They do different things. The one compartment that connects to the patient, which is this compartment, it's the compartment that is going to collect fluid. Now, this compartment over here collects air. It has water too, which helps prevent the air to move backwards. The third compartment or chamber uses suction, and the amount of suction is prescribed by the doctor. This chamber also contains water. Now, what to check for proper functioning of this drainage? So you check for the amount of fluid. Check the amount of fluid should be consistent. If it is more than 70 ml per hour, you need to call the doctor because it can be hemorrhage, or if it is not consistent, all of the sudden increased. You also assessed for the color. The color should be serous sanguineous. Now the water seal, you need to check if it is functioning properly by checking at the titling. If you see titling, means it is good, it's working properly. It means that the patient is inhaling and exhaling. If you see that this looks like the bubbling looks like a jacuzzi, this is the under drainage system. The patient is connected to the drainage system to drain fluid and air out of the pleural space. This system has 3 chambers or 3 compartments. The one compartment connected to the patient collects the fluid. The second compartment collects air, and it has water, which helps prevent the air to move backwards. The third compartment or chamber uses suction, and the amount of suction is prescribed by the doctor. This chamber also contains water. Now we need to check this device, and we check for the proper functioning of this drainage system and for the amount of fluid that is coming out of the patient. So when you check the fluid, you need to check the amount and the color. The amount coming out of the patient should be consistent. If you see that the amount is more than 70 ml per hour, you need to call the doctor because it can be a sign of hemorrhage. The color should be serosanguineous. Now, the second compartment is the water seal. Tidling is good. Gentle bubbling is good. It means that the patient is inhaling and exhaling when it moves. If this compartment looks like a jacuzzi, means the air it's leaking somewhere, is not patent. So you need to check for your connection, what's going on. Now this third one is the suction chamber. To see if normal bubbling is good, it means good suctioning. If no bubbling, not a good suction. So now there are things that you do and things that you never do. So you never milk or strip chest tube, because if you do, you can cause pneumothorax to the patient. Now, what do you do? The drainage system, it's always lower than the patient's chest. The tubes are always straight. You need to check for any kinks and dependent loops. And you always assess the bubbling, tidling, check for the water level, check for the suction control, which is prescribed by the surgeon. Now, what do you need to check for the patient? So when the underwater drainage system is collected and the patient is connected to that tube, you need to make sure that the dressing around the tube is tight and intact. You have to check for the subcutaneous emphysema, which is if you check the skin around the site, if you hear bubbling, that means that is subcutaneous emphysema. Then you check for respiration, breathing, oxygen. You listen to the lungs, you check for the alignment of the trachea, you check if the tube eyelets are visible. Check for pain, assist patient to deep breathe, cough, patient also needs to use the incentive spirometry. You can reposition the patient if the patient is reporting burning pain on chest. Now, there are things that you need to be aware in order for you to decide if you need to call the doctor. So if you see a tracheal deviation, sudden increased dyspnea, the oxygen is less than 90%, the drainage is more than 70 milliliters per hour, or if you see the eyelets on the chest tube, or if the chest tube, okay, that's it. And then if you notice all those, you need to report to the doctor right away. Now, what do you do if the chest tube falls out of the patient? Immediately, you need to cover with a dry, sterile gauze. That's it.
Hi, Bob. How are you feeling now?
Hi, doctor. I'm feeling good.
Oh, that's good. You do look better now. So I got your chest x-rays back. So this is your right lung. It actually, filled back to its normal size. Everything looks good. And I'm glad that you're feeling really good. And you're having easy time breathing too?
Yes.
Okay, good. And do you have any questions for me?
Thank you.
You're welcome. And your nurse will be here to, help you with discharge, okay?
Okay.
Are you going to call Bob? Yay! I'm gonna help you. I'm so happy for you. You're gonna see your family now.
Uh-huh.
Thank you.